Hello, I'm Darren McGee, and today's question asks if I would discuss Munchausen syndrome, these days referred to as factitious disorder, and for the sake of this video I'm going to be referring to it as factitious disorder. Now if you like this video, if you find it helpful, please consider subscribing to my channel for future updates on mental health related topics. But just as a reminder, this video is not a substitute for support from a mental health professional, nor is it a tool to be used to diagnose someone. Now, as I said, originally referred to as Munchausen syndrome, it was named after an 18th century German officer who was well known for embellishing and exaggerating stories about himself, stories about his experiences and his life. It has come to be associated with someone who falsifies, induces or exaggerates illnesses and physical conditions, usually in order to gain attention. People with this disorder may lie about their symptoms, they may avoid or even sabotage medical tests. In extreme cases, they may even harm themselves. But it can be a serious mental disorder in which someone is deceiving others by appearing sick or injured, and in extreme cases purposely getting sick or self-harming, as I said. Factitious disorder can happen also where a family member or a caregiver falsely presents others, like maybe a partner, their children, their parents, whatever, falsely present them as being ill, injured or impaired somehow. Now that's what will be known as Munchausen by proxy. That's going to be a video I'm going to cover at some point in the future. Today I'm just going to focus on whenever the person is presenting themselves as ill. Now the symptoms can range from being mild, which might be just slight exaggerations of symptoms of illnesses, or they may be severe where the person claims to be chronically ill and desperate need of surgery. But I think it's important to recognize that factitious disorder is not the same as inventing an illness or a condition for some kind of practical benefit, such as maybe getting out of work or maybe winning a lawsuit. People with factitious disorder, they know that they're causing, a lot of time they're causing the symptoms of their illnesses. They know that they are deceiving others, but they might not understand the reasons for their deception. They might not even recognize their behaviors as being problematic. Illnesses may range from having a severe flu, an allergic reaction to something, a long-term unhealed injury. It isn't always easy to recognize what is real and what isn't, because there could be very real conditions, things like cancer being mentioned. Other times they may just claim something outrageous, like they've been struck by lightning, or they get motion sickness when they change station on the television set. They can also go to great lengths to hide their deception, and that can make it hard to recognize, especially if it's part of another mental health disorder, which I will talk about later on. But they will often continue with the deception even when there is no actual benefit or reward, or even when they are faced with objective or even conclusive evidence that doesn't support their claims of illness. They will continue with the deception. Now, some of the common symptoms and characteristics and behaviours associated with factitious disorder include being very convincing of medical or psychological problems, in the sense that they know the symptoms, they know the difficulties associated with those conditions. They may have extensive knowledge of certain conditions and diseases. Other times there may be inconsistent or vague symptoms that come and go in different situations, and the conditions, they never seem to get better with any treatment or medication. In fact, sometimes they even get worse for no apparent reason. There may be a reluctance to talk to anyone, talk to a medical professional about their illnesses, and claiming the medical profession doesn't get it, they don't understand, or either that, or they may insist on talking to many different specialists in those areas, but always discounting their opinions or their diagnoses, even arguing with their consultants or their doctors, or even with the hospital staff if they're not being treated or diagnosed the way they think they should be. Other common characteristics of the disorder include exaggerating symptoms, issues, injuries, traumas to appear worse than they really are. There can also be actually faking symptoms such as seizures, headaches, stomach pains, intense anxiety. There can be made-up medical histories. They may lie to partners, family members, support groups even. They may even sabotage their own medical tests, even if it's something silly like warming up a thermometer somehow or trying to contaminate a urine sample. In extreme cases, they may self-harm by tampering with infected cuts and wounds or making themselves sick to try and induce vomiting, or they may even take something that they know they have an allergy to. In other cases, they may refuse to take medication, claiming they have an allergy to the medication. So what's going on with factitious disorder? Well, like I said, it's not that there's any particular benefit to exaggerating illnesses or conditions. It just seems to be mostly about gaining attention through being in the sick role, so that people will pay attention and care for them, and in some cases even perhaps excuse them. There has been little research, but in some cases it has been evidence to suggest that whenever someone was younger, they may have had extensive medical procedures or prolonged illnesses and went on to develop factitious disorder when they were older. Now, this could be because they associate childhood memories with that sense of being cared for, and as they got older, they're trying to maybe obtain those same feelings of reassurance by pretending to be ill. However, there have been other cases where perhaps there's been a lot of evidence of childhood neglect, and perhaps being ill or injured was the only attention they got. So again, as they get older, they find this maladaptive way of getting attention and care from others through being ill. Now, in some cases as well, there may be other mental disorders or personality disorders present. For example, antisocial personality disorder. Now, this could be when someone enjoys manipulating others. They enjoy deceiving others. Others perhaps they see as powerful, people like the medical, the legal professions. Someone with borderline personality, now they would find it difficult to regulate how they feel and would often swing between a positive and a negative image of themselves and indeed others. With narcissistic personality disorder, what we would see is someone who is struggling with seeing themselves as being worthless and useless and unlovable, but also having a very strong sense of being special, unique, and entitled. Now, personally, when it comes to factitious disorder and narcissism, certainly not exclusively, but I think it would be more associated with vulnerable narcissism as opposed to grandiose narcissism. And I think the reason for that is with vulnerable narcissism, what we often see is someone manipulating others through maybe guilt tripping and shaming and that needing to be looked after somehow. But regardless of the disorder, it could well be that that person has quite an unstable sense of their own identity. They also have difficulty in forming meaningful relationships with others. So being in the sick role can allow them to adopt an identity that's going to bring support and acceptance from others. And it could be feasible that a component of this could be that somebody may have a grudge against certain people, certain groups of people, certain professions, such as, say, the medical profession, or caring professions, or perhaps those that they see in authority. That, however, is only speculation on my part. Now, factitious disorder can be difficult to identify, and it can be difficult to treat. And this is often due to the deceptive and manipulative side of it. Many people with the condition, they refuse psychological or therapeutic treatment. So although we can speculate, it is unclear why they behave the way they do. So that is a brief outline of factitious disorder or Munchausen syndrome. Now, as always, please feel free to use the comment box below. There are some interesting conversations starting around these videos. If you liked this video, if you found it helpful, please consider subscribing to my channel. And until next time, thanks for watching.